So welcome all of you. Today we talk about the gluteal region. So what is the gluteal region? Gluteal region is the anatomical region which extends from the iliac crest above to the gluteal fold below. So in that particular region, we have got muscles, and a very large muscle we have got there, which is called the gluteus maximus. And this muscle is important for us to stand from a sitting position. So this muscle is responsible for extension at hip joint. So when we see the gluteal region here, as you can make out in the diagram, so this is the upper margin of gluteal region and this is the lower margin of gluteus maximus. So upper margin of gluteus maximus is there and lower margin of gluteus maximus lies at this level. So this is the muscle which we see at the back in the gluteal region, at the back of the buttock. So once we remove this particular muscle, there are many muscles underneath these muscles. So what are these muscles which are lying underneath the gluteus maximus? They are the gluteus medius, and then gluteus minimus also lies in the anterior superior quadrant. And then below the gluteus medius, we have got piriformis. We have got the two gemelli, gemellus superior, inferior. In between them lies the obturator internus. We have got quadratus femoris, we have got adductor magnus, and we have got the hamstring component arising from the ischial tuberosity. So all these muscles are lying under cover of gluteus maximus. Also, the nerve supply of the muscles is lying under cover of gluteus maximus. The gluteus maximus is supplied by the inferior gluteal nerve, while the gluteus medius and minimus, they are supplied by the superior gluteal nerve. The piriformis is supplied by the ventral rami of S1-2. Superior gemellus and obturator internus, they are supplied by nerve to obturator internus, while inferior gemellus and quadratus femoris are supplied by the nerve to quadratus femoris. So the nerves supplying the muscles are also lying deep to the gluteus maximus. Then we have here in the gluteal region the greater sciatic notch. The greater sciatic notch is called the gateway of the gluteal region. And this greater sciatic notch is there. Below it lies the lesser sciatic notch. The greater and lesser sciatic notches are converted into foramina by the sacrotuberous and the sacrospinous ligaments. So this is the sacrotuberous ligament extending from the sacrum to the ischial tuberosity. This is the sacrospinous ligament. So the greater sciatic notch, which is converted into a foramina, that is referred to as the gateway of the gluteal region. So what are the structures passing through the greater sciatic notch? So let us see. These structures are defined in terms of the piriformis muscle, which is the key muscle of the gluteal region. So this muscle is the piriformis muscle, which fills up the greater sciatic notch. So in relation to the upper margin of piriformis muscle lie the superior gluteal artery and nerve. In relation to the lower margin of piriformis lie the inferior gluteal artery and nerve. Then we have the sciatic nerve, which is the thickest nerve of the body, 2 centimeter wide band it forms. Medial to it lies the posterior cutaneous nerve of thigh. Then we have the pudendal nerve, pudendal vessels, nerve to obturator internus. So they all pass through the greater sciatic notch. Nerve to obturator internus is supplying the gemellus superior as well as the obturator internus muscle. Now this pudendal nerve, internal pudendal vessels, and nerve to obturator internus, they subsequently pass through the lesser sciatic notch, where the pudendal nerve and internal pudendal vessels lie in the pudendal canal. So pudendal nerve, internal pudendal vessels, and nerve to obturator internus, they also pass through the lesser sciatic notch or foramen, and along with it, the obturator internus muscle, it fills up the lesser sciatic notch. So structures passing through the greater and lesser sciatic notch also lie deep to the gluteus maximus. They lie under cover of the gluteus maximus. Then the other thing is the ischial tuberosity on which we sit. It also lies under cover of the gluteus maximus. So you have to describe the structures under cover of gluteus maximus under the following headings: the muscles, the nerve supply of those muscles, then the structures passing through greater sciatic notch, structure passing through lesser sciatic notch, and the ischial tuberosity. So there is another thing which you should know, that okay, the action of gluteus maximus is extension at hip joint. The gluteus medius and minimus, these are the muscles in which we give the intramuscular injection, and these muscles, they are responsible for abduction at hip joint. So there are actually three components of the abductor mechanism at hip joint. The first component I have already mentioned is the power, and this is provided by the gluteus medius and minimus. The second component comprises of the normal relationship between head of femur and the acetabulum. If this relationship is compromised, as in dislocation of the hip or congenital dislocation of the hip, then we say that the fulcrum component is defective and there will be problem in abduction mechanism. The third component is the weight component. The weight is transmitted from head to neck of femur and downwards. So if there is a problem with the normal relationship of the head and neck of femur, like an ununited fracture of the neck of femur, then we say that the weight component of the abductor mechanism is compromised. So the power component may be compromised, fulcrum component may be compromised, and weight component may be compromised. And all this results in defective abductor mechanism at hip joint. So when this mechanism at hip joint is defective, then the Trendelenberg sign is positive. So what is the Trendelenberg sign? If you see here, there are three scenarios, A, B, and C. So let us look at scenario A first. Anterior superior iliac spines are marked as ASIS. So when a person stands erect, that is scenario 1, the two anterior superior iliac spines lie in at the same level. So this is the trunk, this is the lower limb, right lower limb and the left lower limb. So when the person puts weight on one limb, suppose the person puts weight on right limb, that is the scenario B. In that case, the opposite side anterior superior iliac spine is normally lifted by the right side gluteus medius and minimus. So the left side, when the weight is put on the right side of the limb, the left side anterior superior iliac spine is normally lifted by the right side gluteus medius and minimus. So A and B are representing the normal scenarios. In case of a problem with the right side gluteus medius and minimus, suppose they are paralyzed or defective, not working properly, then what will happen is that the right side gluteus medius and minimus, on putting weight on the right side, they will not be able to lift the anterior superior iliac spine of the opposite side up, and it will sag down. So that is called positive Trendelenberg sign. So that depicts a defect in the abductor mechanism. So students, you should know the structures lying under cover of gluteus maximus, the actions of gluteus maximus, medius, and minimus. You should be able to explain the anatomical basis of the Trendelenberg sign, and you should be able to enumerate the structures passing through the greater sciatic notch and the lesser sciatic notch, and you should realize that the piriformis is the key muscle of the gluteal region. So with that, we end this topic today, and the next time we will meet when we do the hip and the knee joints. And thanks for watching. The notes are available for this topic. If you have already received them, fine. If you want them, you can request for them. So thank you for watching once again. Till the next time we meet. Bye-bye.